Hi again, Melinda Bachini back. I want to give a 2021 advocacy update. What motivates the advocate? How do you become an advocate? These are questions I get asked all the time. There is no typical advocate, and there are many pathways to becoming an advocate. An advocate can be a patient or a survivor of cancer, a caregiver, or anyone who wants to better the journey for a patient. Advocates can be involved in research, policy, fundraising, awareness, and so much more. For me, I became an advocate because I felt so strongly after having a great response to the clinical trial I participated in, and I wanted to find a way to pay it forward. I began volunteering for CCF about 10 years ago, and I've been blessed to come on as full-time staff over 3 years ago. I also serve on several national cancer panels, such as the NCI Council of Research Advocates, NCI Hepatobiliary Task Force, ECOG-ACRIN, and the NCCN Guideline Panel. I am privileged to be able to represent the voice for our patient community. As a patient advocate for CCF, I get the honor of replying to patients' emails and phone calls every day. I try to help provide resources such as the specialty map, Biomarkers Matter video, Citizen, remote second opinion options, help with navigating clinical trials, which are all needed to help navigate this complicated diagnosis. CCF has incorporated monthly support groups for patients and caregivers along with monthly educational webinars. Our virtual support groups are held on the first and third Thursdays of each month at 4 p.m. Eastern Time. You can find the registration link on our website under Calendar of Events. These support groups have been well attended and provide a great opportunity to facilitate conversations, make connections, provide information, and share resources. Our Research Advocacy Committee is comprised of about 30 patients and caregivers. These advocates have been attending virtual conferences and trainings, participating in patient advisory boards for academia and industry, doing grant reviews, patient material reviews, and representing the patient community as our ambassadors. We are so fortunate to have a wealth of experience from our all-volunteer Research Advocacy Committee. The CCF care teams were created to positively impact the lives of cholangiocarcinoma patients through advocacy, research, and education. The care teams were established with the vision of having several different teams spread out throughout all geographical locations to be able to bring awareness for cholangiocarcinoma to their local communities. We encourage care teams to host CCF-sponsored activities and fundraisers and be involved in many of the CCF programs and events. If you're interested in joining or leading a care team, please reach out to Cindy Thomas at cindy.thomas@cholangiocarcinoma.org, or feel free to message one of us throughout the conference. This past February, CCF launched Wellness for Life with the help of several care team members. The mission for Wellness for Life is built on nurturing a community to support health and wellness among those who are affected by cholangiocarcinoma. We all know that focusing on our wellness can be a doozy. Please join us every week for Wellness Wednesday for live programs related to all areas of wellness. Coming soon, we will be launching our Newly Diagnosed, Newly Connected program. This program will provide patients and caregivers the guidance they need to navigate diagnosis and throughout the full course of your treatment. It will start with an introductory email series that will have important links to resources and video interviews with patients and caregivers who are surviving this disease. We'll also be able to send care kits to provide a little love and support as you navigate your journey. We will provide links, connections from trusted partners, only without any hogwash. We are also super excited to provide our first cholangiocarcinoma nutrition resource. The content is written and it is now in the design phase. It was produced by dietitians from some of the top medical institutions who specialize in hepatobiliary care. We look forward to getting this resource out to you as soon as possible. I want to highlight the Cholangiocarcinoma Foundation's relationship with our trusted partner, Citizen. Citizen aligns with our core values, is a trusted partner, does quality work, complements our strengths, and also has a shared passion to help cholangiocarcinoma patients. Citizen and CCF together is more than just about gathering your medical records. CCF was so excited when Citizen launched the clinical trial matching service for all patients who signed up on the Citizen platform. This report is so beneficial to patients as it matches you based on your inclusion-exclusion criteria of the clinical trials that are available. So far, over 60 patients have been matched. Be sure to check out their new interactive viewer that is now live. Citizen and CCF are supporting patient-driven research. The Map It Forward results will be presented today, and thank you to all the patients who participated. We will also have Dr. Mathel and Dr. Kilson up next to talk about the Emory CCF Citizen Quality of Life Study that is now recruiting through a patient survey that can be taken from a link on this conference platform. For every person who takes this survey and signs up with Citizen, you will receive a $25 gift card. Also, you will get 2,000 points to go towards the prize competition we are doing throughout the next 3 days. It is such a benefit to have all your medical records in one place, including your scans and biomarker results. All of these services are provided for free to the patient. I am living proof that clinical trials save lives. Citizen matches you against 89 cholangiocarcinoma trials and almost 300 solid tumor trials. Explore their new interactive clinical trial viewer that filters options by trial stage, therapy type, and location. Please go to www.citizen.com/CCF to learn more. Be a part of the cure and join the 1,500 strong movement and get your free I'm Part of the Cure shirt today by signing up with Citizen and requesting your medical records. And FYI, this shirt will also be given to all participants for the Emory CCF Citizen Survey. Another reason to go take the survey right after Dr. Mathel and Dr. Kilson's presentation coming up next. Lastly, as I always end my presentations, I want to remind myself of why it is so important to accelerate research and why it is so vital for patients to participate in research and why CCF is here supporting patients and caregivers. We want to hold close all the memories of all the warriors and loved ones who have gone before us and make a difference for all those who will be diagnosed. Thank you so much.